How was the lab? How were the labs? Good? Dirty? Yeah, stinky?
No.
Smelly? That's what I'm talking about. Nice.
The digestive tract smell.
Oh, I can see that. Yeah, that's the, you know what is that smell? Reality. That's the smell. Okay. So we're going to, hopefully we can have, like next week, we're going to have another round of that, and then we're going to have presentation. So you'll see that from now on we're going to mix it up more. You know, the applied and even in the case scenarios and stuff. I don't know, did you guys go through this portion? No. Over adhesives and stuff. I don't want to spend way too much time because I really want to go to the pathology side and start cranking that side on. Part of so did you, sorry, before you go, so did you explain the importance of having the groups? And,
yes.
Okay, that's good. So just have the group. Okay, good. So not for the presentation. So really. This class, this entire class, which is on Canvas, I think one nice portion of this class, which is, it's a lot more to do with all the systems we have had so far. It talks about pregnancy, it talks about lactation, it talks about hibernation, it talks about changing salinity from salmons then when they go either from river to sea or sea to river. Because those are, some of those like very simple, but at the same time super useful examples of how those systems, all the way from kidneys to cardiovascular to stuff, changes for non-pathological reasons. Okay? So the idea, for example, of the, when we think, for example, on the pregnancy, in this slide, we call it pregnancy as an adaptive process, or lactation as an adaptive process. And it goes all the way from simple things as saying, hey, is immunology related with gestation? No, you have to have a certain understanding that, you know, immunology should be somewhat related to gestation. And it's a simple question, and it will involve some of the things that we talked about during the immunology class, but has nothing to do with bacteria. It has nothing to do with viruses. It has to do with how do you keep somebody inside of you that is half not yours. Okay? So if you think about it from a regular immune point of view, we have all been aliens inside of our moms. Okay? If it was for the actual, you know, immune system of our moms, we would be expelled during gestation. But then the body finds a certain way to kind of shield you from direct, you know, attack, you know, from the memory system. So it's a very, very nice topic. You know, it can have lots and lots of, so you go here, influences of some steroid hormones, you talk about some of these T cells, something that we talked about, and it goes on. And this is the part that I don't want you guys, once you go over some of those slides, don't be caught up on super details or names that you have never heard before, especially during class, because it's not the idea that we go over in that much detail. But once you go to the actual presentations, the idea is that you actually go inside a little bit each system. So, for example, some of the cases is about autoimmune disease in the skin. Well, you're going to have to go into what the skin is made of. How is that? Where is the autoimmunity against? Where, you know, it goes against what? It's a protein. It's something else that is in the skin. So that's the part where you're going to probably start reading stuff that you didn't see in class. But the idea is that you don't get uncomfortable with those things. Is that you try to focus on the primary stuff, and the rest is like, you will learn. You'll learn with time. That's why I don't like much the little details, because the little details you read, sometimes you're going to use for a specific case, and that's it. You know, eventually sometime, if you remember that for another case, that's what experience is. As you build more cases in your portfolio, you're going to remember more stuff, okay? So it goes into all these things. It talks about the next one. It talks about, for example, lactation. And lactation, for example, is one of those processes that you have enormous change from a metabolic point of view. All of a sudden, you're producing these large amounts of milk. And I say this either for humans or for dairy cows. That's the stuff that, for example, I work with. By the time you start producing large amounts of milk, the energy demand for you, when I say for you, for the animal that is lactating, it is enormous. You know, have you ever heard of people that, either friends or stories from people that you know, oh, once you're lactating, you start losing weight. You know, they go and then they say, oh my God, you know, you eat a lot and you still lose weight. Why? Because you're producing, you know, metabolically, you are very active. And to actually produce milk is very costly. What does that mean and how this could be used for, to understand? If you understand lactation, you actually do understand body weight loss. And you can understand, even from a certain point of view, what it means to be starving. Because you can starve two ways. One, you don't eat. The other one, you spend a lot more than what you eat. Okay? And both of them, they have different significances, but in both, you lose weight. And as you lose weight, you have a bunch of little things that will happen. So, for example, lactation is a super, super nice example on how to study a little bit of biochemistry of what carbohydrates, fatty acids, especially carbohydrates and fatty acids. Why? Because once we start going through this, you're going to see that your whole hormonal system from a metabolic point of view will shift. Will shift from what? Glucose processing to fatty acid processing. So basically meaning you're going to start to survive by burning fat more than actually using glucose. And that has changes in insulin levels, you're going to have changes in glucagon levels, you're going to have changes in a bunch of other systems that I told you. Oh, from the endocrine point of view, you're going to have to know some of them, but then I think it's a good example of how you go about that. So, as I said before, energy requirements, glucose, endogenous reserve, mobilized. When I say endogenous reserve, this is fat reserves being mobilized, lipolysis, and then you have to go over like what causes that. Okay? My idea is that you start looking at some of these very specific examples with a different set of eyes. Okay? Before that, so you go many slides. You go into basically all the hormones that goes about during lactation. As I said before, we can go at a later time, we can maybe go into details. I'm not going to ask specifically about this class. I used to have this class as actual part of the program. Now it's more like an annex. Like, you know, you have that as a case study, much more like a case study than anything else. But the idea now is that we move a little bit faster towards the pathology and the other sides, because before, what I used to do is like, I talk, and then I would still keep like those very important sides of, you know, treatments, antibiotics to the end, and I would have to rush for that. So let's do this other part first. If you have to go back to see more case studies, we go back to this. Is that okay? Nice? Very good. Very good. So, pathology principles, nice. Let's talk about how things go wrong now. Nice. The transition between what was right, what can be wrong, was the immune system. During the immune system in stress physiology, we touched base. Maybe I should have placed inflammation there, but then it's really a transition. So now, every time when we were talking about what does the innate immune system do, and by the time you have the adaptive immune system kicking in to help with antibodies and specific cells to kill germs and stuff, that it's already within the inflammation. When that is occurring, other things are happening. So for example, the idea for this pathology class is that we're going to talk about some cellular changes and stuff, because the only reason why we put it some of the cellular changes is that I wanted you to kind of understand what happens to a cell once it becomes with a certain disorder. Okay? But the systemic changes are, I believe, for this class are more important. So if you, for example, have problems with your heart, and we have mentioned this several times during class, and you start having problems with blood pressure, now we're going to see what actually happens to your heart. And the other ones, maybe you have, I think we touched base several times on edema. So you have accumulation of fluids outside the vessels, in place interstitial space. A little bit is okay, a lot is a problem. And then we're gonna, so those systemic changes tends to be more important for this class than actual cellular changes, but we're gonna touch base in some of those. The other thing is that when we talk about the inflammation, and the initial part of this pathology class is, and it's actually super important, because this is where we start to be more or less like a detective, and you start to really crank up a little bit and try to get every little lead that you can get towards a certain case to say, oh, this is what could be wrong. And for this class, this is the most important side. I don't want you to say, oh yes, this animal had hardwired disease and that's why the heart was that way, and you had like a piece of wire going through the reticulum and poking the heart, and they start to have, it's okay. You don't need to know that, but you need to start thinking on what systems could be affected, and you have a list pretty quick. This could be wrong, this could be wrong, and this is how I would go about it. That's it. So all these concepts of pathology, etiology, pathogenesis, and syndromes, but especially etiology and pathogenesis, the source and the mechanism are the two most important. Some of the other 3 or 4 here are more like this, what would be more like a macro kind of thing, and this portion here would be like a micro changes. Are these important from even a systemic point of view? Differentiating between cell death and programmed cell death is indeed important. Why? Because one, the cell death or necrosis causes inflammation. The second one does not cause inflammation. They both lost function, they both die. But the problem is that one, you have all the content of the cell in the interstitium. The other one, you are so organized killing the cell that you kind of, program in a certain way where another macrophage goes there, eats, and no remnant of that cell stays around. It's a big difference. Some of these injuries here, we're going to go towards, what this, and especially these injuries here, the macro and micro. I try to give examples that are easy and more common sense than actually specificities that, for this class, it wouldn't make much sense. But you're going to see that it will apply a lot to the stuff that you guys have already learned. Physiological stress and stimuli. In this case, for example, when you go to cell disorders, this can be caused, and at this point, we're not going to go specific to which agent is causing. It can be all the way from trauma, physical stress, to actually an actual virus or an actual bacteria or whatever that fungi, whatever that is.
Basically speaking, when you talk about stress in a cell or in a tissue, that means that something is going wrong that is making that cell or that tissue not acquire those very basic principles of homeostasis that we mentioned in the first class. pH, temperature, nutrients, CO2, O2 exchanges and stuff. Something is going on in that tissue or cell that is probably making that environment somewhat wrong, okay? It can be lots of things, but some of these things here, for example, you have an adaptation process and you have a kind of a cellular injury. Every time you have that, you know, and all those names, hypertrophy, hyperplasia, atrophy, metaplasia, we're gonna go to some examples in pictures, but this is something like this. Once you start having a certain stress, the cell doesn't necessarily go from super active to die, to death. That doesn't go like, unless something really bad happened and you poke a hole in the membrane of the cell. But normally, the body is very good at trying to keep them alive and trying to adapt to the situation. So take, for instance, people that smoke. You know that eventually that's what's going to kill them. But it doesn't kill them in 1 year, not even in 1 day. It takes decades for that to happen. Few things can happen once you smoke, all the way from killing all the ciliated cells in your trachea that makes those, like, you know, people that have smoked for their whole lives, they start coughing in the morning, and it takes a day for them to remove everything that is. Why? Because they killed all those ciliated cells in the trachea, that normally those ciliated cells, they do what? They bring all that dirt, dust, whatever, from the trachea all the way to the upper respiratory tract, where you can do gross stuff and remove it, okay? So what happened to that tissue? What happened to that tissue that's still there? You still have a trachea, but all of a sudden you're no longer able to do certain things. This is, for example, this is one example of metaplasia, where, for example, where you have the cells, but they no longer provide the function they were initially designed for, okay? Hypertrophy and hyperplasia, I think the best examples that you can get is something like this. You go to the gym, you want more muscles. So what do? You cause micro injuries to your muscle cells. By doing what? By lifting weights. By the time you lift weight, you cause certain bruises, some lesions to your muscle cell, and in turn, the muscle cell does what? First, I need to repair that. Second, it grows. Why? Well, I'm being exposed to a certain stress that seems to be continuous. You know, seems to be all the time, you know, you're going through that. So it grows. So you have, in that specific case, you don't have more cells. You don't have that much cell division in muscle cells. But what it does, it grows. And sometimes you do have. So it grows not only in size, but you grow a little bit in number too. Okay, so you have both hypertrophy and hyperplasia. Your kidneys, for example. Take, for example, someone that have lost a kidney or have donated a kidney to somebody else in the family because they are needed, and all of a sudden, can you survive with one kidney? Have you ever heard this story? Like, you do have, and lots of people, they do survive, and they do actually survive well with one kidney. But what happens to the kidney? It grows. You have a super kidney, okay? They have like why? Because the necessity, and in some ways, can you say the stress? You can. All of a sudden, all the blood flow that would go to 2, now is going to 1. It's a lot more. Somehow, the cells develop to grow, to multiply, and this is not necessarily super bad. But you see, that word Adaptation. You adapted, to the circumstance. Yes, all of a sudden, all of those can be reversible or irreversible that then leads to cell death. And it's a question of what caused that. Okay, hypertrophy, again, can be physiologic, can be pathologic. Big examples of hypertrophy are muscle, heart, uterus, so it grows in many ways. Pregnancy, do you have a hypertrophy of the uterus once you start gestating? Yes, you do. Your uterus grows like crazy, okay? And it has to. Is it pathological? No. Does it mean is it the same? That doesn't happen either. No, it is a very different uterus than what it was in a non-pregnant state. Hyperplasia, it can be caused by many things. But in this case, hyperplasia, in general, is more towards a pathological origin. Okay, can you have a little bit, from a physiological take, for example, fat cells. You eat a lot, it grows. It's not necessarily, it changes, like the cell changes a lot. And sometimes if you accumulate too much fat in some other cells other than adipose tissue, you can have big problems. But you have somewhat of a hyperplasia of the cells. They grow in size. Sometimes they grow a little bit in numbers, but they grow, and you have to adapt to that. What is the difference between hyperplasia and cancer? I'm saying that, hypertrophy is the growth of the same cell just grows. Hyperplasia is when you have actually lots of cell division. So you have multiplication of cells. So the idea then is like, what is the difference between hyperplasia and actually cancer? And can one be a lead to the other? Can having too much hyperplasia eventually lead to cancer? What is cancer?
It's uncontrolled cell growth.
It's uncontrolled cell growth, more specifically uncontrolled cell division. So you have lots of this, so you can grow in different ways, but in this case, for hyperplasia, you still keep a certain control of that. Cancer, you no longer have that control. So in a hyperplasic tissue, you can still grow and maintain structure, form, function. In a cancer, all of a sudden, you have a ball of mass somewhere in your body. Why? Because that's growing without any sort of structure. Okay? That's what? Tumor. By the time you have that encapsulated in a certain way, that's a tumor. Does that make sense? Yeah? Very good. That's some examples of what happens to your heart. And we mentioned a few times that what would be an example that we talked in which the heart can go from this regular state. This is imagine your heart and you make a section of this. And this is your left ventricle. Basically the most important chamber that you have because it has to pump to the rest of your body. And this is a normal one. And these are two types. You don't need to understand what is this is a centripetal one, this is a centrifugal one. But in both cases, you have increased, either in mass and size. What is the problem with this one? Your chamber is too small. You probably you have lots of muscle, but you have very small chamber. This one here is the opposite. You have the chamber that is too large. Your chamber is too large from a volume point of view. Your muscle layer would have to be even larger to have the same amount of power than that one. In both cases, they went through pathologies of the cell. They probably went through hypertrophy. Hypertrophy in that case was what? An adaptation.
compensate for, we saw many cases that we discussed that, oh, we made the heart pump faster. Give me one example. What would be a case where, a simple case where you make your heart pump faster? Why does the heart pump faster during exercise? You need a lot more blood flow, so your oxygen consumption is going up. All of a sudden, there are sensors, your aorta or carotid, and they say oxygen levels are going lower. You go, oh, by the way, the guys that just won the Nobel Prize for Physiology and Medicine is exactly on, some of them discovering how they know how the body senses the lack of oxygen, but they also found how the cell senses and what they do about it. Okay? And by the way, so in this case specifically, it didn't go, the animal didn't go from this to this in one day. It took probably years, or months at least, for that to happen. So it's a overworked heart that has probably a chronic condition because it didn't happen out of nowhere or just for a little short time. But the end result was it was overworked, and this adaptation, this hypertrophy, led to what? Led to the heart not being able to pump as much. Okay? That's an adaptation that led to a pathological condition. Okay? Will all adaptations lead to a pathological condition? Of course not. Okay? Of course not. But they're going to go through this. Some of these things, for example, you can go to another type. So one is metaplasia, so hypertrophy, hyperplasia. Atrophy is actually when you start having, I think the best way to describe atrophy is like you start losing function of it. So, and normally you start losing size. Okay? So if your kidney would go into a certain atrophy, probably your kidney would start shrinking. For whatever reason, instead of adapting to increase, starts the adaptation for somehow. One of the very, very common cases is like when you lose innervation to a certain muscle. Sometimes that occurs very often in accidents, and you bumped your arm during an accident and stuff, and all of a sudden you start having like holes, in certain muscles. And these holes are nothing less than your muscle, because of sometimes nerve damage, they start to not having the stimulus to keep like at a steady state position. And normally what they do, if there's no stimulus, there's no reason to grow or multiply, and they start to lose the function, and they start to become smaller. Okay? Sometimes that, yes, can be caused by viruses, by some other things as well. Metaplasia, this is the nicest one because you have phenotypical changes in this. The case for people that smoke, this is probably one nice one where all of a sudden the actual cell looks different. Still is structured, still somewhat doing what it should do, but not 100%. But all of a sudden, the problem with metaplasia is what? It's irreversible. It doesn't go back to the initial state. So if you don't have other cells to replace in a certain way, that's it. Metaplasia and hyperplasia are some of those, or two of those that, tends to be more associated with cancer later on. So if you start having too many cells around you that are going through hyperplasia or metaplasia, it basically means that eventually, if you continue with the same stress, cancer may go and take over, okay? Because they are already dividing at a weird state. They're not dividing naturally as they should. Okay, yeah. Oh, these two examples of, one example here of atrophy. Okay, so you have a horse here that they have like this myoencephalitis is a protozoa. And what it does is that it doesn't necessarily kill the muscle in that region, because what it does is that it affects a little bit some of the innervation. So what happens is that all of a sudden, all of those muscles that have been used to walk, they lose the innervation, and eventually they start decreasing in size. They start to become atrophic. So they start to grow. They stop growing. They don't necessarily. That doesn't necessarily lead to necrosis, which would be uncontrollable cell death, but they lose function and they lose size. Hip dysplasia. So this is probably a common example for all those of you that have dogs, or especially large dogs. German Shepherd is one that is a king of having hip dysplasia. But what is it? The head of the femur and the actual, a place where the head of the femur has to, attach in the hip. Sometimes what they have is like a little bit of a, and that is probably genetic predisposition. You have a little bit of too much grinding over there. And eventually what happens is that that tissue that is supposed to be, imagine the tissues of your, any of your joints. They have to be super smooth in order to do this very, very, very fine movement. They have to have the liquid in the middle. They have to have the right cushion, otherwise it's so painful. And what happens here is that because of that grinding, which sometimes is caused by what? Mechanically, because of the type of growth these animals have, it's never, you have a little bit too much basically grinding between the two bones. And eventually, those tissues, they grow in a certain way where it's like painful, super painful for them. That's another reason why so many people end up going through surgery, hip replacement or knee replacement. Why? Because today we have the technologies to have that joint artificially made, but you at the same time you avoid the tissue going after each other. Okay? And this is one bronchial metaplasia. So this is one of, you start replacing those ciliated cells with some very weird looking cells that doesn't do the job anymore. Again, in that case, the cells look weird? They do. But you still have a layer. This is what is different from cancer. Okay? If that was start growing like, oh yeah, like a little tumor, that's the only difference. Okay? But these cells here will never go back to this state. Okay? Very good. Okay, yeah, we do know that all of this can cause stimuli for cell injury, oxygen, chemical, pH, infectious, immunology, genetic effects, that's a given. Okay, so anything can cause stress. But then, yes, necrosis or apoptosis is important that you understand the difference between the two. And obviously here, necrosis, the hint here is that you have leakage of cellular content. And this, from an immunological standpoint, is the key. By the time you start finding your defense cells, start finding organelles and proteins that are inside the cell, this triggers immune response. Okay, because this is foreign to them. When I say foreign, it's not that they don't, but the way they are presented is foreign. Okay, so they go there and they actually tend to cause an inflammation and try to what? Clean up. We're gonna try as much as they can to clean up. This one here, no. This one here, what they do is more controlled. So you have cells, defense cells actually eating the cell that is going through apoptosis in a controlled way, so you have cell death, but you don't cause inflammation. This thing happens all the time in your body. Apoptosis happens all the time in your body, okay? It's a regular process. This next one, it is something that, I'll leave it like this. I'm not a very big fan of asking you guys about these types of cell degeneration, but I think it is nice that you understand some of, when you have, for example, when you get burned and you have a little bit of water accumulation going, you have a little bit of those bubbles with a little bit of water, or when you're infected by viruses and you have a little bit of those injuries here in the ribs, and you start having a little bit of fluid, like it's not necessarily pus, but it sometimes can vary from very clear to a little bit kind of fibrin, like a little bit. These is types of cell. These are states by which the cell starts to degenerate. Okay, and you have this what you call hydropic, which is water accumulation. You have steatosis, which is called fat accumulation. This happens a lot in the liver. You start people that are super overweight, or sometimes even when you start mobilizing too much fat during lactation in dairy cows, that can happen. Okay? They're losing weight, but they're mobilizing too much fat. Your liver is no longer able to process all of that. They start to accumulate fat inside of the cells. And if they accumulate a little too much, they start losing function. That's bad. That's super bad. But it's the kind of stuff that, can you relate this to a little bit of adaptation? You can. The cell is trying to go a little bit about trying to see how we can reverse this. These two here tends to be more like microscopic, but is the kind of stuff that is, it starts to go a little bit more specific. So glycogenic, so you have glycogen accumulation. Hyaline, you have accumulation of basically anything that goes and becomes a little bit dense and white, so certain types of protein, and amyloid. So it's not like you need to know those things, but the idea is like when you start seeing things, or especially secretions. Do you remember, for example, the case of the hardwired disease with the heart? And I showed one of the pictures, and it was all kind of yellow. So what is that? What is that yellow thing? All those gross things that we see once we get hurt or stuff. These are all cells. They're starting to degenerate. They start to produce certain things, or they start to accumulate things inside of the cell. Generally speaking, it is a form of adaptation, and they would like to get rid of that as soon as possible, but they can't because of the stress. But this is just a sign. So every time, and that's why in pathology you have, obviously, there is the side of pathology that has to be microscopic, so you have to have a scope, you have to have slides, and you have to have histological cuts from whatever tissue that you have to, in order to understand what's going on from a cellular point of view. But a big job of pathologists has to do with macro visualization of either the body or a specific organ. They can tell you from looking at a liver, from looking at a lesion, what kind of degeneration is going on there. And that's one of the things that this help those people to go with. Now this is just a little bit of an example. This is what a fatty liver looks like. This is what a regular liver looks like. So pretty red sort of color. By the time you start accumulating fat, it becomes this yellowish body of blood. And that's
an indication of a very, very bad, actually, pathological state. So you can die from this. And this has a lot to do with basically saying you're accumulating too much triglycerides or too much fat inside of the liver. This is a type of cell degeneration. In this case, it's called steatosis kind of a degeneration. Well, let's go to the fun stuff now. Okay, let's go to more of the systemic changes. And we'll touch base on a few, but you know, some of that will actually be stuff that you guys have already kind of seen during the examples that we gave in class. Let's think, for example, on edema. So for us, all of those things, we already know that edema is when you start accumulating fluids in the interstitial space. When I say interstitial space, anywhere that is not your vascular bed, okay, inside your vessels. Increase microvascular permeability. Very good. So what does that mean? Microvascular permeability. So probably at the very end of your vessels, you have a little bit too much fluids coming out. What is an example of that? When do you think that can happen on from your day-to-day examples that you see? So basically, every time you have some sort of inflammation, by the time you have inflammation, you almost automatically have edema, which is, in order for inflammation to kick in, either because of trauma, which means some cells have died and then the inflammation is triggered, or because of a virus or bacteria, you start having what? Because of the defense cells, they go and they start to free up some molecules, most of the time those cytokines. And what they do, one of the things they do, they release factors that increase vascular permeability. By increasing vascular permeability, they allow cells from the inside of the vessel to the interstitial space. What are those cells? Defense cells. You're trying to get and attract more defense cells to the interstitial space. So basically speaking, this is what it is. Okay, so you can cause this by just increasing somehow, those cells or that, and with those cells, you bring also fluid. Okay, so you remove the amount of liquid from the inside the vessel to the interstitial space. Increased intravascular hydrostatic pressure. Think of this like a physical thing. What does that mean? Yeah, so you're having high blood pressure. You're having too much pushing. So it's not like the vessels are opening more, you just have more going. And with that, you have more fluids passing or not returning to the vascular bed. Okay? Decreased intravascular osmotic pressure. What is the osmotic pressure? I have mentioned a couple times, I think. It's the pressure that is, during the kidney class, we mentioned a little bit. The osmotic pressure is driven by what?
Driven by like large protein molecules.
By large protein molecules. So basically, you have this enormous amount of protein running around your blood. Either to transport stuff, and normally it's that, they have to be able to transport a lot of stuff inside of your body. You have obviously hormones and all kinds of stuff, but in general, for example, the largest one in terms of volume is one that you probably have heard about, albumin. Albumin is one of those proteins that can transport almost everything. It's a very generally, very unspecific, but very
and because of that, they can transport many things. And they are there, you know. And how are they part of this control of pressure and amount of fluid that is inside the vessels? It's basically by osmotic gradient. If you have too much protein, or if you have too little protein inside the vessel, you have less what? Pulling back capacity of the vessel to remove the fluid from the interstitial space. Like, let's give, for example, you have edema caused by liver failure. Liver is the one that produces lots of the albumin in your body. How can a liver failure lead to a very bad, widespread edema? Just said, they produce albumin.
You don't have enough albumin in the blood, then
You don't have enough osmotic pressure, you know, to pull fluid from the interstitial space back to the vessel. So you end up leaving fluid in the interstitial space. Those are bad situations. Why? Because you can, a little bit, you can, once or twice, you can go there and remove some of that fluid. But that fluid accumulation will get back there. Okay, so it's because you don't have enough of that protein inside of you. So nothing to do with inflammation, nothing to do with blood pressure, only to do with the ability of the blood to pull liquid back to the inside of the vessel. Does that make sense? Yeah? And decreased lymphatic drainage. We didn't mention much of the lymph system, but the lymph system is one of those systems that is basically everywhere the circulatory system is, you have a lymph system around. But one of the things that the lymph system does, aside from many others, they transport fat, they transport white blood cells, but they also picked up the remnant of that fluid that your body was not able to do it by its own on the circulatory system. So what is the premise, for example, of lymphatic drainage massage? You know, you go to someone and stuff, oh, I'm gonna have a lymphatic massage and stuff, and people say, yeah, that's awesome. What does it do? Or what is the premise of that massage? Not everyone would be familiar with this, I am not either, but there is a premise for that. They go and say, yes, I feel swollen. You know, I think I'm not feeling well. It's always, I went to a trip and, you know, I have my feet are hurting and stuff, and I'm gonna do this massage. The idea is that you have somehow, massage will help you drain some of these accumulated fluid from certain parts of your body. So the idea is that you can have the lymph system become more active to drain that. So you pull from the interstitial space back to the vessels and so on. So if you have problems with your lymph system, you can have edema. So let's see a few pictures of that. The regular edema that we tend to associate with inflammation is this one. And there is actually a way for you to do this, and the doctors, they actually use that. So if you do this, you know, like here, you see you press and it came back really quick, which basically means you didn't have, what would be a problem? If you press it and all of a sudden you had a hole and just slowly go back. That means that there is fluid around that shouldn't be there, okay? This is very typical of a regular inflammation. Why? Because once you have inflammation, and sometimes, most of the time it's local, you have this accumulation of fluids because your defense cells are calling more defense cells. So what you call, like, they free up some of those, or they release some of those cytokines or some those what they call sometimes is vasodilation molecules, and you start accumulating more fluids in the region. That's why it gets swollen. Every time you have swollen tissue, you probably have edema. Okay? Not all the time, but a lot of times you do have edema. Do you remember when I said this is a problematic thing? If edema happens in your feet, yeah, it will hurt. Not going to be able to use your shoes. Yeah, but you'll survive. If you have edema in your lungs, you have another type of problem because then you accumulate water where gas exchanges occur. And then if you have water there, it's a problem. That's why pneumonia tends to be treated with very kind of urgency. Even if you go to the ER, if you have inflammation somewhere else, it's okay. If you have inflammation in the lungs, you're going fast through the line. Why? Because this can go to a different stage much quicker, and this normally is very associated or very much associated with fever, with loss of oxygenation in blood, and that can cause big problems. So this is another type of edema that is also somehow associated with inflammation. The only thing is that part of the interstitial tissue in the lungs is actually the alveoli, and that's a problem. Now, what about this? This is kind of a weird picture, and I put ascites here because ascites is basically the technical name of accumulation of fluids inside of a cavity. In this case, inside of the abdominal cavity. I think we mentioned once in one of the examples before, once you have accumulation in the abdominal cavity. In this case, the accumulation is occurring all the way here. Okay? And you know what is this here? Say, oh, this is not, no, this is a hole that was poked here, and this is fluid coming out of that hole from the abdomen. Okay, pretty gross. I'm kidding. I like that stuff, but it's a very visual thing. This happens a lot. I've seen this with dogs and stuff. Why this? Remember, why do we accumulate? In that case of the hardwired disease, you had accumulation here under the chin. You had also accumulation in the flap here in the chest. Especially when you have problems with like systemic problems, you start to accumulating, or you start to having so many problems. For example, liver failure. You start to having so much general problems with not being able to remove all that fluid, that it tends to go to, and that's because of physics. It tends to go to places that are much like kind of ventral, so lower, and where you have some space. And the abdominal cavity tends to be a very good one. Why? Because there is some space inside, and at the same time, it is kind of low. So you have this big, I've seen like little dogs that has this like super big belly, and then you go there, you poke a little hole, and they go like, oh my God, that's a relief, and you're removed, but next day, they'll have that again. If the actual problem with the liver doesn't get solved. So these are types of edema that we're gonna be talking over and over, especially for inflammatory things. Lots of the treatments that we do, it's for this as well. It's for this type of systemic problem. The first ones that we saw from a cellular point of view is kind of, the treatment goes by treating the agent or by removing the stress. In these cases here, yes, indirectly you're going to cause that. But then these are the kind of stuff that you can do something about even before starting to remove the agent. So in all of those cases, what you're going to try to do for the most part, and keep in mind that every time you have accumulation of fluid in the interstitial space, very often you're going to cause pain. Why? Because as you grow in size, you start to press tissues, and you start to press what? Nerve endings, and that causes pain. Okay? So one of the things that we try to do, especially in these two cases here is to remove fluids from there. And you can use all the way from anti-inflammatories. Why? Because if you use an anti-inflammatory, they're going to try to what? Remove the amount of vasodilation. So you try to block the vessels again, so you have less fluid going to the interstitial space. Okay? Or in cases that are very, very kind of aggressive, you're trying to remove a little bit of overall liquid from your body. And that can be done by, for example, using diuretics. You know, trying to somehow, for example, modify the way in which your kidney retains water to your body. And sometimes what you do is try, okay, kidney, just keep removing fluids so you can decrease a little bit. Oh, but Ronaldo, can't you lead to dehydration and other things? Yeah, then becomes a game. What is too much? What is too little? So you try to play a little bit that game of how to control. Okay? Very good. Okay, this is loss of blood by any way, shape, or form. That can go all the way from trauma to an ulcer in your stomach to whatever. Every time you start losing what is the difference between edema and hemorrhage? Because in both, you can have, like hemorrhage normally was associated with what? Oh, you made a cut and you start having blood coming out, and oh, that's a hemorrhage. Oh, yeah. But can you have, in this case, for example, what is the difference between a hemorrhage and an edema?
Edema's like stuff's leaking out of the vessels, whereas a hemorrhage is the vessels are like busted.
Yeah, in both cases, you can have large openings, but you're right. Edema tends to be a smaller opening. And edema, all those cases that I showed, you have just plasma coming out. Hemorrhage, you have cells coming out. You have red blood cells coming out. Okay? So by the time you do have that, then it's a problem. Okay, because then at that point, if you start having bleeding, so if you start to bleed, either internally or externally, there's no way in hell that's normal. Okay, it's not supposed to be normal. Okay, so all of this, and this is one thing that is, you probably mentioned endothelial injury. So this is when you said you have a burst vessel or a cut vessel, so you have a trauma for whatever reason. Diabetes here, toxic or infection is like, this is caused a lot by some of these very nasty, infectious diseases like, let's say Ebola. Ebola tends to affect what? Your vessels, your endothelial cells. That's why it's kind of a nasty sort of little virus. Why? Because they can basically dissolve you. You start bleeding from every place you can possibly imagine. Why? Because it attacks the very same tissue that holds the blood together. Okay? So it becomes a problem. But that's an injury, like, does it burst? No, you just start having something that affected, and you start to have too many red blood cells getting out, of your vessel. These types, petechia, ecchymosis, hematoma, bruise, contusion, like all these things you learn when you're in vet school there, you're gonna learn all these types. But these are just sizes it's not traumatic. Those are the kind of diathesis types of hemorrhage. And sometimes you have, for example, you have a certain organ and you start to have like little dots of blood. So you do have something wrong. These dots can become a little. Petechia tends to be very, very fine. Ecchymosis, a little bit bigger. Okay, bruise. So let's say when you get hit and you get bruised and you have those hematomas, and sometimes bruise is a little bit, a hematoma is like large. So it's more about the size of how much that hemorrhage is than anything else. You can probably imply hemoperitoneum, hemothorax, hemopericardium, hemoperitoneum, what? Blood, probably in your chest thoracic cavity. Oh, sorry, the hemothorax is on the thing. Hemoperitoneum and the peritoneum on the abdominal cavity. Hemopericardium, blood inside the pericardium bag that surrounds your heart. So then becomes like hemo whatever, that it, implies that you have blood inside of cavities, okay? Normally, are they super bad? Anytime you have someone like that, it's bad, okay? It's like super bad. Two other things that is related to some of this, like circulatory systemic disorders, like thrombosis and embolism. What time is it? Okay. I didn't shut up. It's okay. So the stuff's like thrombosis is this formation of a thrombus in the blood vessel. And that has to do with, more like to do with the hemodynamics of blood. Why? The blood, they have to follow a certain, if you get, for example, your blood vessel, and this is the cut from your blood vessel. Generally, what's going to happen is that your plasma will be in the surroundings and your cells will be in the middle. They're going to flow. They're going to try as much as they can to flow that way. Why? Because you don't want to have your cells bumping into the walls of your vessels all the time. Why? This is bad. How bad that is? Bad to the point of starting what? If you have, what is the role, for example, of platelets, in your blood? It helps to do what? Clotting, to coagulate. Okay, so if you happen to have something going wrong or you have a trauma, you can stop bleeding fast. It is, if you think about it, it is like amazing, that the body is able to do that. But you don't want to have clotting all the time or happening at will inside of you. Okay, that would be a tremendous problem. But every time you change in the blood or changing blood flow, you start forming these thrombs. And these thrombs, they can be rather small, sometimes they dissolve, or if they start to get too big, what happens is that they can what? Get stuck in a place, and all of a sudden you have what? You have loss of circulation in that area. Sometimes if you have loss of circulation and that happens in the lungs, that's a big problem. If that happens close to the brain, it's a big problem, okay? Because then you have loss of irrigation to a certain part, okay? If that happens, this is what you call embolism, okay? A thromb sometimes can or cannot be a problem. Maybe cannot be a problem. Is it small enough? It didn't cause anything. Eventually, it was just something that happened, a small thromb, and it went away. But if it grew to a certain amount, and all of a sudden it got stuck in a vessel, irrigating a certain organ, that's called embolism. So it is the loss of irrigation to that organ or region because of a thromb, and that's why you call thromboembolism. Okay. When that happens in the pulmonary system, and you call pulmonary embolism, that's bad. That's super bad. Because then, not only you cause the stoppage of the irrigation to the organ itself, you stop exchange of gases for the entire system. Okay? And this is what may cause, like every time you have, for example, this thromboembolism, you have decreased blood flow to a certain area of your body. And can you have ischemia or infarct? You have heard these words before, but infarct is probably more famous. Oh, you have an infarct of the myocardium, an infarct of your heart. What is an infarct of your heart? What does that mean? It's basically blocked. You have supply or blood supply or venous drainage. You have some problems there. Basically meaning in some way, shape, or form, you have blood stopping to go to that region of your body and actually doing, gas exchanges or nutrient exchange or whatever. So ischemia tends to be related to the flow of blood to a certain organ. Infarct tends to be more towards the drainage of that organ. In both cases, you stop gas exchange. So in both cases, you can lead to ischemia or infarct. And think about in these two cases, think about some of the cellular changes that I mentioned before. That you can go through. Imagine this part here. You have this like white areas here in the heart, and this is an indicative of what we call like white infarct. And it's basically what? This is probably caused by a ischemic thing. Something stopped the heart from receiving blood. This is very common, for example, humans. In humans, you eat not very well. Your coronary vessels start to be clogged by fat. At some point, they really get clogged. And what happens, depending on where the clog happened, a whole section of your heart stops getting blood. And then your heart eventually, if that infarct is big enough, your heart stops beating. So what people do, they go there, they put those stents, they open up, and all of a sudden they start, circulation goes back. Does it mean that you solve the problem? Depends. If that thing happened and it's too chronic, maybe you just killed that whole section, and then you're going to have probably, heart problems for the rest of your life. But this is one of those cases. Red infarct or white infarct, this is in the kidney. This one here is a red infarct. Basically happening here, this is a red infarct. This happens a lot in the intestines. It's the opposite. Instead of blocking the supply, you block the drainage. By the time you block the drainage, it means that lots of that blood is still there and accumulated there. Lots of problems there. Okay, so I think we're going to have time to go into a little bit of shock, and then the rest, we're going to continue next class, is going to be more towards inflammation. Shock is basically, the definition is this peripheral circulation collapse. So you basically have, for whatever reason, you have your circulatory system stops having enough volume to keep the rest of your body working. Now, if you go to what kind of shock, you have hypovolemic, cardiogenic, vasculogenic. I think right now, at this point in the class, you can all assume certain things about those types. So you can have less, you can enter shock because your blood not being pumped, basically, so you just don't have circulation going on. That can be caused by what? By some of those infarcts in the cardiac muscle, okay, for whatever reason that happened. Either because of fat, it can be caused because of a virus, of a protozoa, it can be caused by a bunch of things, okay, but that could be caused by this. So that would be called cardiogenic. So you have heart insufficiency. You can have those, hypertrophy of the muscle layer. All of a sudden, the chamber is either too big or too small, and you're not pumping well enough. Hypovolemic. This is kind of, those that are, very common when you have a big accident. You lost, and all of a sudden, I went to a car accident and I lost 2 liters of blood. I'm going to go into what they call a hypovolemic shock. All of a sudden, my heart is going to start pumping like crazy, but there's not enough volume inside of me. Okay? In both cases, either hypovolemic or cardiogenic or vasculogenic, you're not going to have enough blood inside the vessel. One, because you lost the first one. The second one is not because you lost, but it's just not pumping. Okay? Now, vasculogenic. You call anaphylactic shock, neurogenic shock, septic shock. Some of those words are kind of familiar to you. Anaphylactic shock. I think everybody here have heard at some point about anaphylactic shock. Are these anaphylactic shock, for example, is related to what? Allergy. Very good. So in the case of an allergy is basically what? Is this, in the case of anaphylactic shock, is this widespread, uncontrolled inflammation. If you think about this, what do you think happened then? During a regular inflammation process, you're going to have what? That we just mentioned before. Yeah, you're going to have edema. Okay? So imagine that edema happening everywhere in your body. Like you starting to look like a Michelin, that little. Why? Because you're going to have widespread. You were bitten by bees and you were allergic to it, or you got penicillin and you were allergic to penicillin, whatever that is, and eventually your body goes into this anaphylactic shock. Eventually, you're going to have much less fluid inside of you. Why? Because all of that fluid all of a sudden goes away. Can you accumulate a lot of fluid outside the blood? Yes. If you have something like that, and every vessel in your body is dilated, you're going to have problems. Okay? This is the case where if you don't act fast with some sort of very, very potent anti-inflammatory drug and try to pull that thing back, you're in trouble. Neurogenic or septic shock is somewhat the same, but caused not by the immune system. Septic shock is when you have just this super strong, widespread bacterial inflammation, happening. So this is what shock is. So eventually, when we go about, on this, obviously we talked about some of this very, very specific, circulatory things. But those are the things that, eventually if you put it into an example, a case study, that goes into, you can have lots of little things to work on. What happens to the immune system, what happens to the kidneys, what happens to your lungs, heart, and so on. So now next class we're going to start on this. Inflammation then becomes a more more general thing. This is going to be tied up with the your immune system class, somehow. The only thing is that obviously many of the examples that we gave from the systemic disorders are tied with inflammation, okay? Either because it's caused by a bacteria or either because your body, your inflammatory process is uncontrolled, so your immune system is uncontrolled. But then we go through those things, and probably we should be able to finish this class, next class, and then even start something on the, I think the next class will be what, treatments or, no, bacteria and viruses already, and even start some of that. Okay, very good.